This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're at the Aurora Medical Center in Oshkosh. We're heading into the Breast Health Center. They recently renovated this center and they've got some new technology. So come on in, let's take a tour. So we want to start by introducing you to someone very special. This is Cindy Bennett. She's a mammography lead here in the Breast Health Center. So Cindy, thanks for taking some time with us today.
Good morning.
We're kind of in a special area here. Although the center has been around for a while, renovations here, and this is kind of a special place just from when you walk in.
We've been here, I've been here 12 years, we've been here ever since before then, but we've now added an entrance so patients can come in and get right in from off the street and get this done quickly so they don't not have it done.
Yeah, so let's take a quick look here as you walk in. Nice chairs here, but then you come to the front desk here for registration, and Sandy's back there.
Good morning.
And this is where you register?
This is where you register, grab a quick cup of coffee if you need it, or a beverage. We are a center of excellence from the American College of Radiology, as well as the NAPBC, which is the accreditation of surgeons. And that just means that whatever happens in your journey through mammography and breast cancer, we've got you covered.
Right.
We can help you any step of the way.
We know you know what you're doing. That's it.
Got it figured out.
Well, let's keep going. After the registration, you have a waiting room, and again, this is all renovated recently.
It's beautiful, brought into the 21st century, and we have beautiful new furniture, and we have new changing areas for the patients. We always have been complimented on our wonderful gowns that aren't see-through and warm, and have them change, put their stuff in a locker, lock it up. They carry the key on their wrist.
And right after that, we're going into a consultation room as well?
Yep, we have some questions we need to go through. We have to ask about your family history, your personal history. This is one of our education rooms that has some educational materials patients may need. There are pamphlets for if they're scheduled for any procedures. We can help them whatever questions they may have.
All right. So after this, you would be heading right into your screening.
Correct. Then we go off to the mammography portion. The actual picture taking averages out to only about 6 minutes. I mean, it's all electronically digitized for you and sent off to the radiologist.
And the screening is down the hall, but this is a room where we're looking at another room. This is basically a follow-up room. Tell us a little bit about this room.
This is the room for breast ultrasound. So with the 3D technology, which is new, most often that is the reason you're called back. We saw something, we need to get a better look at it, and breast ultrasound would be the way to go most often, not always. And then ultrasound breast biopsies can happen in here also.
All right, so let's keep continuing with the tour here, and we're heading down the hall.
We're a pretty busy center, so trying to find time when rooms are not occupied. This is more of a procedural room. It's our traditional two-dimensional technology. It is digital, full-field digital. It was the gold standard a few years back, and it's now used for procedures, localizations, magnified views, after biopsy mammograms.
And again, this is a piece of technology nowadays. It's still a very relevant piece of technology, but not necessarily one that you would see on your initial visit.
Not here at Aurora Medical Center in Oshkosh. We tend to do everyone on 3D just because it is such an awesome technology that's come out, and there are sites that still have two-dimensional, and that's very acceptable, especially if you're a fatty-breasted woman. The breast tissue has a big deal to do with it, but if you have dense breasts, 3D is the only way to go.
Okay, Cindy, let's take a look at pretty much the jewel of the center here. Now, this is relatively new technology. This is the 3D imaging center?
This is our 3D mammography. Sometimes it's called tomosynthesis, or TOMO for short. This is a technology where it's still a mammogram. It's still using X-ray. The breast lays here. This comes down, compresses. It does still compress. A lot of people say it's not as bad as it used to be. And part of that is because we can now pan through the breast tissue. Looking at, say, a pad of Post-it notes,
yes,
or a book, and That's the old way you would just look at a mammogram. If something looked abnormal, we'd have to call you back. Well, now you can pan through there, and if there's writing on one page, you catch your eye and say, oh, what's going on in her breast there? I need to pay attention a little closer. And that's what the radiologist can do, and have that ability before calling you back always to do it. But
Sure.
of course, it can still look like something real.
Right. With this technology, have you seen an increase of problems being caught early?
Oh, absolutely. When it's a subtle abnormality that's millimeters big, it can be caught at 2-3 millimeters and as just a tiny little subtle abnormality, and we'll investigate that, and sometimes it is just normal breast tissue, sometimes it is really an early cancer.
And you really can't stress the importance of enough of early detection?
Absolutely. The guidelines have changed and they're a bit confusing. It's always best for you and your provider to talk it over and decide together what's best for you, taking in all the factors of your history, your family's history, your metabolic history, are you a smoker, do you have dense breast tissue, and those are all things that you and your provider can decide how often you should be having mammography.
Again, you have to talk with your provider about that.
Absolutely.
Yeah. And now, obviously, the early detection, we talked about that and how important that is. Just with the renovations and the new technology here, what's been the response from patients coming through?
They think we've moved. We have not really physically moved. The machines are in their same places. We've just decorated and redecorated around them and added the entrance, which is awesome to just step in. You can get your mammogram in and out and not delay having it done.
Right. And just being here for a little bit this morning talking about this, I mean, you've moved a couple of patients through here very quickly, and believe me, the cameras aren't here all the time, just today. But I mean, it is a very quick, efficient process.
The picture taking is a quick part of the procedure, and hopefully we can make it fun and something you don't dread having done.
But get it done.
Get it done.
Get it done. Cindy, thank you so much for taking some time with us today.
You're welcome.
If you would like to schedule a mammogram, of course, you can always check with your primary care provider or give us a call here at Aurora at the Breast Health Center. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.